I was the one going, I'm 37 years old, I've never interviewed for a job that I didn't get. And then I graduated and started interviewing for jobs. And you take a lot out of this class. There's a lot of value here. So, does anybody have any questions before we go into it? Anything you want to know about what happens after graduation, externship, interview stuff?
I have a silly question.
No, it's probably good.
Alright, so on your do's and don'ts, what you should and shouldn't wear to the job interview, do they take you for like specific people get the no's, specific people get the do's, or how does that work? And what did you do? How did you dress up?
Oh, I was a don't.
You was a joke? What did you wear?
Crazy boots and a hoodie, and I had lipstick all over my teeth, and bad makeup, and eyebrows that went down to here, and it was fun.
She's talking about for the
I
fashion
fell.
show.
Yeah, the fashion, did you guys do your fashion show yet?
Not yet.
Oh,
We're
that's
doing
fine.
it.
Oh, this is the first week, isn't it?
Yeah, we're doing it the 23rd.
It was a good time, though. You'll enjoy the fashion
You
show.
come and watch. If you're
Oh, maybe. I think the biggest things you need to take from this class is definitely the interview skills. You guys are gonna be educated when you leave here. Speak like you're educated. Don't, grammar's important. The way you carry yourself is important. The way you conduct yourself is important. The way you conduct yourself here is really important. I can tell you from experience that it takes one person to make or break the job for you. Truly, it really does. It takes one person hearing something bad about you and passing it on before that job that was probably yours isn't anymore. It's gonna go to somebody else. So what you say outside, I learned the hard way, it matters. What you say, how you treat your peers in here, it really matters. Because those people are gonna be the people that you join when you leave here. And it's important. So, anybody have any?
I have a question.
Okay.
What influenced you to taking the MCA course?
And I can kind of kick back from my graduation speech, I guess. A lot of you guys might have been homemakers, or your husbands are out of work now, or you're out of work now. And that's what it was for me. Last October, it became very clear that my husband was gonna lose his job and we needed to do something else. So, and I had always wanted to get in the health field, and I landed here. The program was fast, it was good. Every class had value, and I've taken something from every class here, so. But that's how I ended up here.
What's the best advice that you can give us to help us get a job?
Study, learn everything that you can, and more. Personal conduct, really, that's one of the biggest things, is your behavior inside and outside of this place. It really is. That's the best advice I can give you, is just be professional. Be professional when you're here, be professional when you're outside smoking. I mean, we're all gonna goof off and have fun, but watch what you say.
Be on time.
Yeah, don't. You are paying way too much money to not be here every day and on time. Like, that is, don't not come to class. You learn more in a day than you learn in, what, 3 weeks probably? So, in other programs, every day matters here. There's not a day that's a fluff day that you can skip. You're gonna take something every day.
How many interviews did you go to before you got your job as an NCA?
I only had 2 interviews, but I put in a lot of applications, a lot. And it got discouraging for a little bit, but you know, when that right job comes along that you're a good fit for, it'll happen for you.
How long did it take you to get a job after you graduated?
Less than a month.
So if you do try, you'll get it.
Oh yeah, you can't just put in 2 applications and call it a day. I mean, I was a couple hours every night I
And
spent.
does your grades matter?
Your grades absolutely matter. They do. They're a reflection of how much you've learned and how much effort you've put in, so they do matter.
The applications you turned in, were they just not hiring or just didn't want MCAs or?
It's just different scenarios. I might have not been the right person for the job, or I didn't have the right connections, or somebody heard me run my mouth back before I learned better. So, I mean, there's a lot of variables there, so.
But we love you this thing.
What's that?
So we love you this thing.
How did this class help you, meaning career development?
Oh, this class helped me immensely, much to my dismay. No. It really did. These interviews, these mock interviews that you're gonna cringe and you're not gonna wanna go to, man, are they good. They're so helpful. And is it still Cindy and Mariah and,
I'm not for sure.
well, those are really good. They're very helpful. They're a really good tool just to help you see, because you'll be nervous before them and you're gonna conduct yourself much like you would in an actual interview. And the feedback that you get from those, take that, because that's what helped me make the changes, and I think that's what helped in my very last interview that, when I went to MedExpress, so.
So what exactly does your job entail? Like, what do you do on a daily basis?
Everything. No, we go in the morning, we set up the clinic, we have to do like fridge temps and, we have to do quality controls on we do strep tests, pregnancy tests, all that stuff, urinalysis. I triage patients all day long. I draw blood, EKGs, pretty much everything, so.
But you actually do put something from everything that you.
Oh, absolutely. That's something from every single class. Med terminology, A&P, pharmacology, those are big ones, but every single class had value, even the electronic medical records.
Are you certified yet?
Oh, yeah. Get those certifications, they matter too.
So, like, with the certification though, how long do you suggest, like, should you do it as soon as you graduate, or like, how much time is a good time to study in between graduating and testing?
That's dependent on your individual. I mean, for me, the closer to graduation, I felt was better for me, because it's
Right.
kind of that whole, if you don't use it, you lose it. And a lot of us don't have the personal discipline to study every night once we leave here, because we're done. We're done with school. Who wants to keep studying? But you need to.
But the sooner the better.
This, for me, it was the sooner
Well, I
the
mean,
better,
yeah.
so.
What I was on the test and was it really hard?
There's a lot. There was a lot of A&P, a lot of ethics. I had a huge ethics section. I didn't take NHAs, I took a different exam, a different certification exam, but they're all basically the same. A lot of med term. EKG was a huge part of my exam, phlebotomy questions, so basically something from every class, there's something from every class on those exams.
But was it really hard after?
They weren't easy.
Well, I mean, I'm just, like, do they throw things in there that you didn't expect to be on there, or? I mean, did you pretty much already know, basically?
I knew a lot of my stuff, but I took really good notes and I paid attention, and I had those notes then to fall back on to study, so. The NHA classes, are you still doing those? Those are really good to go to.
Those are the workshops, that's every Wednesday.
Those are really good to go to. No matter what exam you would end up taking, if you chose not to take the NHA, those classes themselves are still really helpful for prep, so.
So what exactly do you mean by, like, not taking the NHA, but you took a different certification?
I just certified with a different board versus the NHA. There's several different ones, so.
What's the difference in them?
Just the board that certifies you. They're all my tests were a little harder than some of the other ones, but it's just, I don't know.
But it's the
It's like
same
the
certification.
ACT versus the SAT. It's all a big test, so,
Pretty much the same, just different.
yeah. Just basic same test, just different certification boards, that's all.
But is it the same certification as
Yes.
you get with the NHA?
I'm certified medical assistant, clinical medical assistant, certified EKG tech, and a certified phlebotomist. So.
What do you feel that employers look for most when hiring someone?
Neat appearance, professionalism, that you can speak properly. And that you know your stuff. They're gonna ask you questions on your interview. They're gonna wanna know, do you know how to give an EKG? Really tell me about it from start to finish. How do you administer it? How do you do an EKG? Do you know what meds are administered orally? How do you give shots? I mean, they'll ask you some of these questions, so, and you need to be able to give a good descriptive answer and definitely know what you're talking about, so.
What all did you put in your portfolio, and do you think that it helped you have an advantage?
Laura loved my portfolio. I had letters of recommendation from previous employers, from different teachers here. My resume, good list of references, and extra copies of my resume and my references, so I could hand those to whoever I was being interviewed by. I didn't have a whole lot more than that, but just those basic things, those letters of recommendation, those are big ones, so,
So you feel like it helped you?
yes. I believe that a good portfolio will set you apart from other people who interview.
Your letters of recommendation, what if they weren't anything that you had to do?
And still, I mean, that speaks for your work ethic. If you, like, I worked at Applebee's while I was going to school. And I had 2 different managers write me recommendations, and they spoke of my work ethic and that I was always on time and I never missed a shift. And so those things are important too. I mean, it's not just your education here, it's how you're gonna work. If you're showing up late or calling off all the time, you're not gonna have a job for very long.
But like,
So-
even if your job doesn't necessarily pertain to what you went to school for, it's still good to have a recommendation.
Absolutely. If you can get a good recommendation from a supervisor or manager, just that, you know.
Teachers.
Yeah. So, I had one I sit on a board for Fayette County, and the president of that board wrote me a recommendation. Just that I volunteered a lot of hours, I was at school, but I still, just, they don't have to be for medical related, obviously. If you can get a good letter of recommendation that just speaks to your character and work ethic, that's just as helpful as anything else, so.
I don't have any more questions.
I hate public speaking.
You do wonderful. You do good.
How'd your extern go, and were you afraid of forgetting any information you learned?
I was terrified. I loved externship though. I had a great externship. Where I went, my site was wonderful. I got to rotate through a couple different offices, but I used everything. But there are also some things that you cannot teach that you will learn on externs. How to handle an upset patient or an aggressive patient, or what questions to answer, what questions not to answer. You cannot give medical advice to patients at all. You are there to treat, you can't tell them how to treat their illness or what's wrong, you can't give them a diagnosis. And they're gonna ask you, and they're gonna want you to tell them, and you have to learn how to deflect those questions and kinda defer to your provider. So, and that takes a little bit of practice.
Can you give us an example, like how you deflected on your externship?
I have to do it every day. So, they'll come in and tell you, I think my sugar's low, and, like yesterday, I had somebody that came in with a range of, they thought their sugar was low, thought they broke their foot, and they hurt their back. But they wanted me to tell them, oh, did I break my foot? Did you, and well, we're gonna get you into x-ray and we'll see. I guess it just comes with practice that you learn how to, because each person is different in the way you're gonna have to deflect to the provider, but always just bring it back around that, we'll get you somebody in here that can talk to you, that can give you a little bit better answer than I could, or there's just a different answer for every scenario, but you'll figure it out pretty quick. So your externship, you're gonna be with somebody and you're gonna watch them and you're gonna see how they do it, and you'll pick up their tricks and some of your own, so.
Where did you go to externship?
I went to Southern West Virginia Clinic beside RH.
What did you do there?
I rotated through endocrinology, ortho, and general practice. So I was in ortho, and Dr. J. Mungle in endocrinology, and then Dr. Woodman for general practice. That was the best one. So,
You got a little bit of
oh,
everything.
yeah, it was very well-rounded externship. I learned a lot, and I've used a lot that I learned in externship, so,
Do you plan on going back to school?
yes, I do, hopefully.
So, like, in your case, which would have helped you more, like, as far as like the actual hands-on or like the book learning? Like you personally?
Everybody learns differently. I'm a mix. I like to read everything I can and learn everything I can first, and then I like to watch somebody do it, and then it's like learn one, do one, teach one kind of thing. So that's how I learn best.
Were you really nervous, like when you first had to go to job for the first
Oh,
time?
terrified, absolutely terrified. I think I called Stacy 50 times, blew up her phone with messages, so.
She's really like, oh,
Even worse because her best friend and her sister-in-law work at the Med Express I work at, so there was no mistakes to be made.
I was calling first day, guys.
No, she was messaging when I went in for my interview, but yes, very much so. That's why I say the connections that you make here, they really do matter, because, I mean, I'm working with Stacy's best friend and her sister-in-law, so there's nothing I can do that she's not gonna hear about that's bad, or good, so.
What about
We're
dealing with
acting up
people?
today.
There are days where you're gonna not wanna see that, like, I don't like kids anymore, but.
I see you
Well, my
never
thing-
liked kids.
I love my own kids and certain kids, but
My
it's,
thing is drugs. I can't stand people on drugs.
You're gonna
People
get
that
'em.
come in and are wasting
you are absolutely gonna
people's
get them.
time.
My
How do you deal
externship,
with
for
that?
instance, I'm still working on it. I have one of those faces that kind of, portrays everything I'm feeling, but my externship, I had a guy come in with track marks up and down both arms, down his neck, prison tattoos. I got hepatitis C from taking Lexapro. No, you didn't. Oh, really? But you learn. We had a girl come in, her and her boyfriend came in at 5 minutes till 8. Right before we closed. That's like going to a restaurant, by the way, and ordering
Don't
a
do
full
that.
meal 10 minutes before they close. Don't ever do that. But, demanding that her boyfriend get seen right now. He had cellulitis all over his arm. No?
Go to the hospital.
Former IV drug user. By the way, it wasn't cellulitis, it was a bug bite. But you'll have parents that come in and you can tell that they're high and they've got their kids and you still have to treat them. Even if you don't want to, even if you don't like it.
Correct?
What's that?
You're supposed to report them if they are.
That's more of a discussion you have with your provider. I mean, you cannot take it upon yourself to make any decisions like that.
Like
You-
when somebody comes in with a kid and they're high, can you not let the kid go back?
No, we don't have any ability to do that. You have a discussion with your provider and then there's decisions made from there. But you personally can't just be like, I'm taking your kid.
Well, no, but I mean, can you call CVS and be like, look, I have a patient here.
Your provider can.
Cause I thought we were
Yeah.
obligated as a medical.
No, we are not we are not authorized to do that. That is a decision that is made
It's
by the
the
provider,
doctor.
so. Which may not be a doctor, it may be a physician's assistant, a nurse practitioner, but that, as a medical assistant, you cannot do that, so.
Have you ever had to go get your provider over something like that yet?
I've had to get a provider over an aggressive patient, but not over a situation like that yet, but I've only been working since beginning of November, so.
I'm sure it'll happen.
Does it
Oh,
not
I'm
break your
sure.
heart when you see the kids like that?
Oh, absolutely, I'm a mom, I have 3 kids of my own. Even if I didn't, I mean, human, so. It sucks to see that, it sucks to see somebody who's let their kid lay with a fever of 103 for 3 days, but needed to get her hookup, so she finally decided to bring him to Beckley. So, I've had that happen already.
Makes me wanna punch them.
It
That's
does.
my thing. I don't know how I'm gonna be able to control
But for
myself.
all those bad, you're gonna see so much good. For every bad experience you have, you're gonna have 50 good experiences,
They're probably gonna be
so.
so messed up they won't even notice you're upset.
They do, but they pretend like it's not, they're on it, but simple addict behavior.
But you can tell.
You
always
can tell. You can definitely tell, so. And me personally, this is one that, I hate pee. Everybody has something they hate, mucus, right?
I cannot stand mucus.
I'm with you, Rachel.
Tracheas.
See, I'm cool with pee, I cannot do the pee, so I have made myself every day, I try to do as many urine dips as I can. I did do Rachel's pee yesterday.
Drip test.
But yeah, I hate urine, so get out of your comfort zone, force yourself into doing things that you hate.
Would you rather deal with poop?
Not really, but they're usually in containers, it's not so bad, but the pee's open but
It's flashing.
definitely get out of your comfort zone, keep trying to learn stuff, like, my job, this is one of the reasons I love it, there is not a day that goes by that I don't learn at least 5 new things. A new experience, new symptoms, new tests that I haven't got to run, just every single day I learn something new and I put myself out of my comfort zone because that's the only way you get better and you learn more. So when you get to work, continually try to do things that you find intimidating or scary. It can help when you do them, but there's always gonna be someone around to help you.
Are you ever worried about catching anything?
Oh, I was sick for the first month I was there.
Well, that's not-
You're all gonna be sick.
What about diseases and stuff?
Not if you take proper precautions.
Do you get to do the strep test?
Oh, yeah, about
Don't do
50 a
it.
day.
I mean, you actually get to do them yourself?
Oh, yeah.
Sorry, I didn't mean to cough in your face.
So.
And mono tests, and pregnancy tests, and urine dips, and, we lost Ace Pylori. Dr. Ambrose is very mad.
Why did they take that away?
Just a corporate thing, nothing to do with that. We just draw blood for it now instead of doing a finger stick, so.
So, no offense to Stacey's friends and family, but is MedExpress where you wanted to be? I mean, was it your first choice?
I just wanted a job, but yes, and I love it. MedExpress is a wonderful place to work. I mean, they're long days. I get there at 7:30. Last night I didn't leave till 9:30. So, because 15 people walked in the door, 10 till 8. But, 12, 13 hours there is like 4 hours at Applebee's. So, when you're doing something that you really enjoy, it's more than just a
Applebee's
job.
was rough.
Yeah.
Applebee's was rough.
I love that job. I love what I'm doing.
If you wasn't certified, would you have got the job still?
They don't require certifications, but most places do, so.
CNAs can be a medical assistant. The one in Lewisburg, she's a CNA.
I would get my certifications, cause I had interviewed for a job and the job was mine, but then they closed the position it was a traveling, you went and did like EKGs, just basic healthcare, like health screenings, and you absolutely had to be certified as an EKG tech and as a medical assistant just to do that job, so. It was a good job.
You said you wanted to keep going to school, like you wanted to go back to school.
Yes.
What do you want to be like, when you finish, what do you finally want to be?
See, since I started MedExpress, it's kinda changed. I've been looking at the physician's assistant program, so,
You're smart enough, you can do it.
but,
How long is that program?
it's a 4-year program, so. But, I'm also looking at UC's RN program, their accelerated 18-month RN program, so it's kinda, we'll see. Right now, I'm just happy to be working.
With the flow, going with the flow.
Yeah, pretty much. And there's gonna be days you guys get overwhelmed here. When I was here, my husband lost his job about 3 months into my school here, from when I started. I was working full-time hours at Applebee's. I was going to school, and then I graduated, and I was working 3 jobs, because he still hadn't found a job yet. But there are things, this is just temporary. So put everything you have into it. It's gonna be hard, there's gonna be days you're tired, there's gonna be days you're up at 2 o'clock studying because your kids wouldn't let you study or you had to work. But I promise you, all the effort that you put in, it will come back.
How many days a week do you work now?
I'm just part-time at MedExpress, but part-time at MedExpress is 2 days, full-time's 3 days, cause they're 12-hour shifts. So I work 2 days at MedExpress, and then I still have a second part-time job that I go to. So that is not medical school related. Still working on that.
What is your favorite part of your job?
I don't know, I like most of it, so, I've really started to like doing off-med physicals. We do occupational health physicals for, a bunch of different companies, mining companies, DOT physicals for the Department of Transportation, and those intimidated the crap out of me. But, once you take your classes and you just, like, I kept forcing myself to do them. I did like 12 yesterday just because I hate them, they scare me, they intimidate me, so.
What are they? What's the-
Just off-med physicals, like for David Stanley, they just get a drug test. Valley, you guys come see me at Valley, from Valley, so. But, just things like that. For DOT, for their, CDLs, we do their physicals there. And basically, that's just triaging your patient, and some of them get a drug screen. There's a company that gets the whole gamut. They have to have an EKG, they have to have chest x-rays, blood draw, so a basic triage. But there's a lot of computer work with those, and they intimidated me, but, now I think they've grown to be one of my favorite things to do there, so.
How many times have you had people say, fail a drug test, and they don't know how?
Lots, lots.
I mean, there can be false readings, but
Then when you get a fail there, you just send it out to the lab, so you're not allowed to give results.
yeah.
So,
Which MedExpress do you work at?
going up on Harper, the busiest one.
It wasn't that busy when I was there.
No, you hit it a perfect time, like that sweet spot from like 1 to 4. If you guys have to come for your drug screens, it's time to come.
All
So I got my TV.
What's that?
I said, I'll just get in the parking lot and go in once, like those people did you last night.
It's the worst.
Y'all ready to go in?
And you're not allowed to say anything. Can't be mean to them even though you wanna be.
When you wanna go, tonight? You work
Yeah,
tonight?
You work tonight?
No, I don't.
Well,
I'll wait till tomorrow.
he's gotta draw pins like, man, I was hungry. I'm so hungry. Like, I get all today, woo, 7:58, what are you doing? Feed me.
Sometimes we can get away with locking the door at 7:58.
That's not good.
We'll be there at 10 to.
We'll be out there pulling on until 8. Tell them,
Yeah, you're gonna be there at 7:55, just.
Yeah.
7:55, yeah, we'll be there at 7:55.
That's-
Or
Or
if
just
they
on a
already
day I
locked
don't
them,
work.
Just beat on the door. I don't work there anymore, so I don't.
Can people do that if it's before, if it's like 7:58 and they knock on the door, do you have to
Yeah.
go in?
Heck, yeah, you do. If this is
She's
something-
like, I'm going.
I don't lock the doors, so
That's
I
like-
don't.
Well, you're supposed to, you don't.
I don't, that's the front office, I don't handle the doors, so I'm in the back.
Subway, they like shut their door on like, say they close at 11, they like shut the door like 10:55, so Josh Rice goes up there and I'll be like, and they're gonna let me in, I'm like, look, man, it's,
Nice for you,
but I'll just be
water
good,
hose.
right?
Okay, guys, it's almost time for break. Any more questions?
Learn how to deal with it, you're gonna have to interact with your providers too. And a lot of times they're not gonna be very nice to you, don't take it personally, it's just it's just them. Some of them are wonderful and awesome and treat you as an equal, and some of them don't.
Do you
Do
have
y'all get any
problems?
patients that gotta be sent to the ER?
What's that?
Do you get any patients that
Oh.
ever need to be sent to the ER?
Yes.
I mean, like.
Now, keep in mind, we're right across from RGH, literally. We've had heart attacks, strokes, all kinds.
Can you guys treat them there, or do you have to send them?
We have to send them, so.
You have,
I mean,
I don't know.
Do you wanna be treated at Med Express if you're in the middle of a full-blown heart attack?
I mean, I just didn't know if you guys were equipped to do it.
We have nitro, we'll give them nitro to EKG and call the ambulance, which is right beside us, for them, you know, cause they didn't wanna go to the emergency room, they came to us, and it's gonna cost them $800 to go across the street, but.
Well, I mean, I was just wondering if you guys were equipped to do that, cause I mean, I'm sure there's a lot of people that don't know.
Minimally.
When to go to Med Express and when to actually go to the hospital. So I didn't know if you guys were.
Well, there's very little that we can get you to a bed, we can call, and, I mean, there's a doctor there, there's a provider there, so there's basic things that we can do, but,
Right.
you know.
But all in all, they have to.
Whenever you did your extern, or if you had, I don't know if you had any other medical job before you went to Med Express, but did you have any problems of RNs?
From art,
Just in externship or where you worked?
Like the RNs are.
Oh, no,
better
no,
than
they're-
you, and you gotta do their work.
I'm asking because my sister-in-law is in LPN school right now, and she said right now she's at rotations and she's on the pediatric floor, and she said she has a really hard time with the RNs, like being bossy, I'm over top of you.
it depends on where you're at, there's a hierarchy, I mean, there is, there just is. So, but you gotta remember your RNs put in 4 times the amount of education, if not more. So there just is. But, for the most part, people are generally, I mean, you're gonna have bad people no matter what, it doesn't matter where you work, you're gonna have an idiot somewhere, someone who's mean, somebody who thinks they're better than you, and someone who trained for a long time, went to school for a long time, that's the nicest person you ever met, and treats you very decent, so, it's like anywhere else.
Have you had anybody try to put you down for being an MA? Like,
No.
well, you should've got your LPN, or?
Not in a nasty,
MA?
I've been encouraged to go further, but never in a derogatory way, so.
So like besides your nerves on your first day, what was your first day like? Like what did they have you do on your first day?
Ortho was a lot of front office, it's, so I was, everything, I was answering the phone, faxing, filing, so, once I got into ortho, there was a little more patient interaction, general practice, man, I did everything. I didn't even go near the front office, it was all back office, so.
That's good, you had a good experience.
It was a very well-rounded externship, but you only get out of that externship what you put into it. I mean, that is the place where you go when you ask questions and you watch what they do, you watch their routines, and then you figure out your own.
Spelling matters.
That's what I wanted to tell you. You should have part of your pharmacology, like a day, where you just get on YouTube and Google all the hard medications to pronounce, because I still feel like an idiot. So, pronunciation matters, spelling matters, how you speak matters. When you go in with the ain'ts and the we wases and the we seens.
My
Don't
sister's
do
an
that.
RN, and she said that they use their phone all the time for everything.
Oh, yeah.
She said all the time.
For like the correct.
I don't take none of us take our phones our phones stay at the nurse's station. We do not take them into rooms. If we have questions, we can step out, but do not take your phone into a patient's room, ever. There's a time and place for your phone, even if you have to look something up, even if you have a question, you leave that phone out there and go out and do it. You don't just whip out your phone. So, and you never answer a call or a text when you're with the patient either. So. Oh, and hygiene matters too, guys. You're gonna be up close and personal. Don't stink. Brush your teeth, have some Tic Tacs. I smoke, so I have a coat that I wear to smoke to try to keep the smoke off. A light body spray, nothing too crazy that's gonna bother people, and Tic Tacs. Tic Tacs and gum. So, besides, you're gonna get some people where you're gonna wish you had some Tic Tacs in your mouth to
The
break up the
cat
smell.
eat ones, and they smell like they sweated for weeks and haven't changed.
You're gonna run into a lot of that.
What is, one thing that you would recommend to us when we go on externship, what would it be?
Pay attention and ask questions. Do not be afraid to ask questions. Even if they're not until your externship meetings, write them down, but ask questions. And if you are not sure of something, do not do it. So, there's things in which you could do that you could hurt somebody. And if you are not sure of what you're doing, ask for help, ask your questions. Write them down, bring them to those meetings. That's what those meetings are for. Because a lot of you are gonna be scared to ask questions at externship. I was the first couple days. I didn't wanna look like an idiot.
Right.
So,
Did you learn how to properly do injections at your externs?
no, I properly learned how to do injections here. And then it had been so long since my pharmacology course that I had asked Stacy if we could do a refresher before, because I knew I gave a pile of injections on externs. So pop,
That's the only thing that I'm kind of worried about.
ask for a refresher.
Oh, yeah.
Absolutely. That's what these guys are here for. They're here to help you. They're here to honestly, they all just want you to succeed. They want you to do the very best that you can. And it sounds cliche and it sounds trite, whatever, but they really do want you to do well. And they really will help you if you want to learn, so.
I have one more question.
Okay.
This being a 10-month programming course, when you first started coming here, did you feel like overwhelmed, like, oh my God, I can't learn all this stuff and cram all this in 10 months? And remember it.
I had been out of school for 19 years. I had been at home for 11 and out of the workforce when I came here. I was terrified. But from day one, I took good notes. I studied. I made time. I was here at 8 o'clock every morning. As soon as I put my kids in the bus, I was here an hour early, because I couldn't study at home. I have 3 kids. It was hard to study at home. So I came here. I stayed after. I studied at lunch sometimes.
Our notes, our flashcards.
Color-coded flashcards. Make me those flashcards. There's. I still have mine, you know?
I have mine. I have all mine. I can pay for medical
Well,
term.
Everybody